Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Today, I want to talk about something most men avoid, fear, or misunderstand. The prostate exam, specifically the digital rectal exam, the finger test. After performing and reviewing thousands of prostate exams over decades of clinical practice, I can tell you this. This simple test can save your life. And yet, many men delay it, avoid it, or misunderstand what it really means. Let's break it down in a clear, calm, scientific way. The prostate is a small gland about the size of a walnut, located just below the bladder. Its main job is to produce fluid that nourishes and protects sperm. But as men age, this gland often grows. Sometimes it grows benignly, a condition called benign prostatic hyperplasia or BPH. Other times, changes can indicate inflammation, infection, or even cancer. The digital rectal exam allows a trained physician to feel the prostate directly. They're not just checking size, they're feeling for texture, symmetry, firmness, and irregularities. A healthy prostate usually feels smooth, slightly rubbery, and symmetrical. Hard areas, lumps, or irregular borders can signal the need for further testing. Every single day, men all over the world silently carry a risk they rarely talk about, rarely check, and often ignore until it is too late. A risk that grows quietly inside their bodies, sometimes for years, without pain, without warning, without symptoms. That risk is prostate disease, and in many cases, prostate cancer. Here is the shocking truth. Prostate cancer is one of the most commonly diagnosed cancers in men globally, affecting more than 1 in 8 men during their lifetime. In some countries, it is the second leading cause of cancer-related deaths in men. Yet it is also one of the most treatable cancers when detected early. The difference between life and death can come down to a simple test that takes less than a minute. The digital rectal exam, often called the finger test, is one of the oldest and most direct methods doctors use to assess prostate health. It is simple, clinical, and highly informative. And despite modern technology, it remains one of the most valuable tools in early detection. When a doctor performs this exam, they are not guessing. They are feeling the prostate gland directly, checking its size, shape, firmness, and symmetry. A healthy prostate usually feels smooth, soft, and symmetrical. A prostate that feels hard, uneven, or nodular may indicate inflammation, benign enlargement, or in some cases, cancer. Research shows that combining this physical exam with a PSA blood test significantly increases the chances of detecting prostate cancer early. Early-stage prostate cancer often has no symptoms at all. By the time symptoms appear, difficulty urinating, pain, blood in urine, the disease may already be advanced. This is why doctors emphasize screening, especially for men over 50 or over 40 if there is a family history. Now here is the emotional reality. Men often delay prostate exams due to fear, embarrassment, or misconceptions, but the exam itself takes seconds. The discomfort is minimal and temporary. The information it provides can save decades of life. Imagine a man who avoids screening for 10 years. During that time, a small cluster of abnormal cells grows slowly, silently. By the time symptoms appear, the cancer may have spread to bones or lymph nodes. At that stage, treatment becomes more aggressive, more painful, and survival rates drop significantly. But imagine another man who gets screened early. The cancer is detected while still confined to the prostate. Treatment is simpler. Survival rates exceed 95%. He lives to see his children grow up, to travel, to enjoy life, all because he chose a 1-minute exam over a lifetime of regret. Now let's talk about something even more powerful. Your daily lifestyle and food choices can significantly influence prostate health. Scientific studies have shown that chronic inflammation, poor diet, obesity, and sedentary lifestyle increase the risk of prostate enlargement and cancer progression. For example, lycopene, a powerful antioxidant found in tomatoes, has been linked in multiple studies to reduced prostate cancer risk. Lycopene neutralizes free radicals that damage DNA and contribute to cancer development. Cooked tomatoes, tomato paste, and tomato sauce contain even higher concentrations of bioavailable lycopene. Cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and cabbage contain sulforaphane, a compound shown to activate detoxification enzymes and inhibit cancer cell growth in laboratory and human studies. Men who regularly consume these vegetables have been found to have a lower risk of aggressive prostate cancer. Green tea contains catechins, especially EGCG, which have been studied for their anti-inflammatory and anti-cancer properties. Some clinical trials suggest green tea extracts may slow the progression of prostate cancer in men with early-stage disease. Pumpkin seeds are rich in zinc, a mineral essential for prostate function. The prostate contains higher levels of zinc than most other organs in the body. Low zinc levels have been associated with prostate enlargement and impaired hormone regulation. Fatty fish like salmon, sardines, and mackerel provide omega-3 fatty acids, which reduce systemic inflammation and may slow cancer progression. Inflammation is a key driver of both benign prostate enlargement and cancer. And then there is exercise. Regular physical activity improves blood circulation to the pelvic region, balances hormones, reduces insulin resistance, and lowers inflammation. Men who exercise regularly have a lower risk of aggressive prostate cancer and better outcomes after diagnosis. Maintaining a healthy weight is equally critical. Excess body fat increases estrogen levels in men and alters testosterone metabolism, which can contribute to prostate growth and cancer risk. Obesity has been linked to more aggressive prostate cancer and poorer survival rates. The truth is, your prostate health is not determined by fate alone. It is influenced every day by what you eat, how you move, how you sleep, and whether you choose to get screened. The finger test is not about embarrassment. It is about awareness. It is about taking responsibility for your health. It is about understanding that prevention is always easier, cheaper, and less painful than treatment. Doctors who have performed thousands of prostate exams will tell you the same thing. The men who come in early are the men who live longer. The men who wait often wish they hadn't. This is not fear-mongering. This is reality backed by decades of clinical research, epidemiological data, and real human stories. So, start today, drink green tea. Add tomatoes and broccoli to your meals. Snack on pumpkin seeds. Eat fatty fish regularly. Exercise daily, even if it's just a brisk walk. Maintain a healthy weight. And most importantly, talk to your doctor about prostate screening. A 1-minute exam. A few simple lifestyle changes, a lifetime of difference. Your future self will thank you for the decision you make today.